This one is a case report on COVID infection in the second trimester of pregnancy, where the fetus had massive intraventricular hemorrhage or a brain bleed. Now, before we begin, let's just talk about what a case report is. So, predominantly, there's two main reasons to write up a case report. One is saying, hey, this is a very unusual presentation that we noticed. If you see something like this, then this is what we did and how we diagnosed it. So it's sort of like shooting off an alert, and when people are like, I have a weird patient, I don't really know what's going on, they can look and find that and be like, okay, so this matches this patient. Maybe I should follow a similar protocol to what they did or something like that. The second reason is to light off a warning flag for, hey, I think this might be an alarming trend that could be happening in the near future, which triggers people to go, oh, that's very concerning, I should do a retrospective analysis of it, or I should create a study that looks at this very specific question. Now that we know, let's dive in. In this case, the patient was a 36-year-old woman who contracted COVID during the 15th week of pregnancy, where 7 weeks later in ultrasound, they saw the brain bleed. Ultimately, at week 23, they had to do an abortion, where they then sent the fetal remains to pathology, where on histology there was lots of fibrin deposits and inflammation of the placental tissue, with a confirmed massive cerebral hemorrhage in the fetus, which essentially confirmed SARS-CoV-2 placentitis, which resulted in lack of oxygenation for the fetus and resultant inflamed placenta. Where on histology of the fetus brain, there was no infection in the brain. The massive intraventricular hemorrhage was likely a secondary effect of the placental damage, where the placental tissue was positive strongly for COVID testing. But again, despite the massive hemorrhage in the fetal brain, there was no COVID found in the brain tissue, where COVID-infected placentas seem to result in acute and chronic inflammation, fetal vascular malperfusion, with a pretty high rate in about a quarter of patients having a fetal vessel thrombi, so blood clots that were thrown into the fetus to the fetus. So ultimately, this is a case where maternal COVID infection in the second trimester resulted in fetal hypoxia, not getting enough oxygen due to placental complications, and ultimately fetal intraventricular hemorrhage, so the brain bleeding, as a secondary result or direct secondary result of the COVID infection in the mother.